Hi, I'm Jenny Backus, Acting Assistant Secretary for Public Affairs right here at HHS, and welcome to our 10th web chat on the Affordable Care Act. The Affordable Care Act is full of important benefits for you and your family to help bring down health care costs, improve the quality of care, and give you more control over your own care. But it's a large bill and sometimes the details can be confusing. Plus, there's also been some misinformation out there. So today, we're here to answer your questions. Today, we're going to talk about a really important topic, fraud prevention, and how the new law will protect you and your family and help law enforcement crack down on criminals who've been stealing from Medicare and other government programs. Today, we have the top U.S. Health and Human Services and Justice Department officials here to answer your questions. Joining us is Secretary Kathleen Sebelius of the U.S. Department of Health and Human Services, or HHS, Gary Grindler, Acting Deputy Attorney General at the U.S. Department of Justice, Kathy Greenlee, Assistant Secretary of the Administration on Aging right here at HHS, and Peter Bedetti, Deputy Administrator for Program Integrity at the Centers for Medicare and Medicaid Services. And this is actually a new department started by the Secretary to focus on fraud prevention right here at HHS. I want to thank you all for coming. Just quickly, we've asked all of you watching to submit your own questions. And if you want to send us a question right now live during our chat, you can tweet us. Our Twitter handle is @HHSGOV. Or you can always email us. And that address is healthreform@hhs.gov. If you could keep your questions brief, because we may have to paraphrase longer questions and we don't want to waste any time. If you don't get to your question today, look at our website, healthreform.gov, and you'll hopefully find your answers because every day we try to hit as many frequently asked questions there. So let's start the show. Secretary Sebelius, you recently had a press conference with Attorney General Eric Holder about fraud prevention in the measures in the Affordable Care Act. Can you talk to us a little bit about what you guys talked about and what those provisions are?
Sure. The President has made it clear from the outset to both the Attorney General and me that fraud prevention and prosecution is one of his top priorities, that we have to take taxpayer dollars very seriously, and we certainly want to shut down the scams that fraudulent activities wreak havoc on seniors and other victims of fraud. So here and at the Justice Department, we've joined together with a special effort called HEAT, the task force that's going to amplify our efforts on fraud, put more boots on the ground. We're now in 7 cities with investigators and prosecutors. We want to expand that with the resources that the President has allocated in our new budget. The Affordable Care Act gives a whole series of new tools, including one that allowed us to set up the office that Peter is now going to head. So we have an official who's going to do nothing else but look at activities that we can crack down on fraud in Medicare and Medicaid, the 2 big public programs. We're going to make it harder for providers to fraudulently register to get billed from Medicare, more information up front, more verification of who they are, toughen the criminal penalties. The Assistant Attorney General, I think, will talk about that a little bit, but much tougher on crime on both the civil side, people who take money, and the criminal side of over $1 million in fraud. There'll be almost doubling the sentences under the sentencing guidelines. We want more investigators, more ability to stop a claims payment if it looks like it's not on the up and up. We want to mobilize with Secretary Greenlee the opportunity to look at our senior medical patrol, Medicare patrol, the seniors who get trained and tell their friends and neighbors about fraudulent activities. So a whole series of efforts on, cracking down on people once they commit fraud, trying to prevent it in the first place by toughening up rules to get into the Medicare program, to get paid, being able to stop claims payments so we don't do the so-called pay and chase, try to follow up on the claim, and use all the resources available in both the Justice Department and our agency to make it clear to folks, go somewhere else if you want to rip people off, because we're very serious about coming after you.
Well, Secretary just mentioned this, the HEAT task force. Can you expand on it a little bit more? I think it's the first time you've ever seen this cabinet level cooperation. And also, I think that at this press conference you put out a report about sort of your success to date. Can you talk a little bit about that?
Sure. I mean, the decision to go forward with the HEAT task force and have it chaired by Secretary Sebelius and Attorney General Holder was really reflects at a cabinet level what a high priority healthcare fraud is. And if you look at this report that came out, you can already see the successes that have come from the effort, this redoubling of our effort to combat healthcare fraud. For example, in 2009, $2.5 billion has been deposited in the Medicare Trust Fund, and that's an increase of $500 million over the previous year. If you look at the number of criminal investigations, we have like 1,000 new criminal investigations, and really a record-setting year in terms of indictments and convictions. Over 800 indictments and 600 convictions in 2009. And we also look at the Office of the Inspector General of HHS has had a great success in removing people from being able to bill Medicare and Medicaid. I think over 2,500 individuals and entities have been removed or terminated from their ability to do that. So you can see from the report the success that is coming from this effort that's stemming from the task force.
Now, we have the high-level cabinet sort of cross law enforcement, but the Secretary mentioned boots on the ground. Kathy, can you talk a little bit about the Senior Medicare Patrol? And also, just for viewers, we have a special website at HHS that came out of the HEAT task force that everybody here contributes to called stopmedicarefraud.gov. You actually may be watching that webcast on that site, too, and there's lots of good information there. But Kathy, go ahead and talk a little bit about this program.
You know, one of the best assets we have to help fight Medicare fraud are seniors themselves and other Medicare beneficiaries. They don't want to be victims of fraud. They don't want the Medicare program to be a victim of fraud. So we have a Senior Medicare Patrol in every state and all of the territories. And the nature of that program is that we train seniors on how to protect themselves, to keep their number protected, their Medicare number, how to read their billing statement, and what to do if they suspect that there's been waste in the program or fraud in the program, so that they can work with us and report that to law enforcement, and certainly work with our partners at CMS who can look at the big picture based on what the seniors see themselves. So we have this in every state, and the website that you referenced is a good way to get that information.
Peter, new office. We talked a lot about arresting people and finding people to arrest, but you're doing stuff to actually prevent fraud from happening in the first place. Talk to me a little bit about what your new office is doing and how you interact with the other people here.
We're focusing on two aspects of that. One is keeping the people out of the program who don't belong in the program, and yet they want to submit bills to Medicare, and then being able to hold back payments so that we're not writing the checks when we think we shouldn't be writing the checks. On the first part of that, keeping people out who want to get into the Medicare program and submit bills to us, that's a big job. We get 18,000 new applications every month for people who want to bill the Medicare program. And we know that most of those applications come from legitimate providers and suppliers of equipment. So our task is to screen out the ones who don't belong in the program while not making life more difficult for the ones who do belong in the program and who are going to provide good services to Medicare beneficiaries. And the same thing holds true on holding up payments. We want to make sure that providers who are providing good services to Medicare beneficiaries get paid on time, get paid properly for their services. But we don't want to send a check out if it's going to the wrong people. So we have a lot to do to change the system and to change the way that we're looking at people getting into the program and the way we're paying claims, and we're doing it. And we're going to be much more effective about doing that in the future.
Well, okay, so we talked about sort of the high level, but there's also stuff that's happening to people watching day to day. And this is actually a really kind of scary but powerful question from Judy from Wisconsin. And Kathy, maybe I'll start with you and anyone else can jump in. Judy says, I was approached about the replacement program for seniors called Obamacare and was told it is better than old Medicare. Is this true?
Jenny, there's several things about that question that are troubling. We are hearing through our SMP program that seniors are being telemarketed by scam artists, as well as their scam artists going door to door. What they are often told is a lie, which is that there's something called Obamacare. That's not the name of any government program. It's just a word. All seniors who have Medicare protection still have Medicare coverage. That coverage has not change. There will be new improvements to the Medicare program, new benefits that start next year. But right now there's nothing for them to buy, and certainly not something called Obamacare. They should be very, very leery of someone who tries to sell them something right now associated with the health reform.
Well, actually, Peter's...
But as a follow-up to that, not only be leery of it, but as Kathy earlier said, turn that information over. I mean, turn into our helpers on the ground. If someone asks for a Medicare number, if someone tries to sell a fraudulent policy, nothing could be better than to have that senior become our eyes and ears and boots on the ground and actually give that information back to us so we can go after those guys and they don't target somebody who's not as wary as the first senior may have been.
Now, what I was going to say is that, oh, go ahead, Gary.
Well, I was just going to say, in terms of following up on turning that information over, there are places where people can go to turn that information over and to have people look at what's going on, what fraud may be taking place. So the FBI certainly has offices throughout this country, and a simple phone call can initiate a response to this type of concern. We have United States Attorney's offices in 93 districts throughout the country. They have a healthcare coordinator that could be reached in order to provide this information. And the website that you mentioned a moment ago is a place to go to see where there are resources that they can tap into, again, to report what's happening.
And I was actually going to just add, with Peter's shop, and CMS just recently sent out, we talked about this last week, but a brochure that actually does tell you about what's in the Affordable Care Act and how it impacts your Medicare. And every Medicare beneficiary should have received this. You can download it on our website. I think you can see it on our screen. We also have, and I will actually come back to a question on this, but the $250 rebate check is coming out soon. And I know, Secretary, I might actually just go to you right now on this. That's been an area that you're there's a reason why we're doing this fraud show right now around these checks.
You bet. Well, part of the Affordable Care Act will actually help seniors who reach the so-called donut hole, the gap in prescription drug coverage, which about 8 million seniors reach every year, and help over time eliminate that gap altogether. But the first year, here in 2010, the first step is that seniors will get an actual check, a $250 one-time check that will help pay for their prescription drugs. Seniors do not have to do anything, to apply for the check. We can monitor their Medicare billings. They will automatically be sent a check. We think over the course of the 5 months left in the year that about 4 million seniors will receive those checks. They'll be mailed every 3 to 4 weeks. When we identify a senior who has hit the donut hole, the $250 check will be mailed. But what we're hearing, which is, again, frightening activity, is people showing up at homes of seniors, asking them to sign their name, give their Medicare information, apply for the check. Again, totally fraudulent. You don't have to do a thing. If you qualify, the check will be mailed. And again, we'd like to use the good suggestions to ask you to follow up with us and make sure we know if people are trying to really steal your information, get information that they shouldn't have under the guise of helping you to get your check.
So stop Medicare fraud.
Secretary, we also heard through our S&P program that seniors were being asked for their bank account numbers so that someone could help them with that $250. All these things are very troubling and should be reported.
You bet.
All right, so we're talking about, so let's say we get to catch one of these folks. Mitch wants to know about how did this partnership between DOJ and HHS come up? Is it because we don't have enough resources in either agency to do it? Is that why you had to combine? That's his question. Is DOJ partnering with HHS because they don't have enough resources? Each of you guys don't have enough resources on your own. I think you sort of hit that, but...
Yeah, I mean, the answer is we have a long history of working with the Department of Justice, with the Department of Health and Human Services to combat healthcare fraud. We bring different levels of expertise to the problem. We have people in the Department of Health and Human Services that help in terms of the data that's necessary to analyze where fraud may be taking place. We have investigators from the Office of the Inspector General, the HHS that are involved in the criminal investigations. And then on the Department of Justice side, of course, we have the FBI, we have other agencies that law enforcement agencies that can get involved with this, but we are the prosecutors. So it really is a partnership. It needs to be a partnership. And in the Medicare fraud strike forces that have been in the 7 cities that were mentioned earlier, I mean, it has been a true partnership in order to fight this crime, and it's worked.
Well, and I think what's happened, Jenny, in this administration is there were 2 strike forces on the ground that were here kind of historically, given the fact that Medicare alone moves over $1 billion a day in payment out to both citizens and providers. There's a lot of money moving around, and unfortunately it's a target for sometimes very sophisticated criminal activity and sometimes just sort of sleazebags who are out trying to rip off people and make a quick buck. So it's the whole range of activities. And I think the president felt it was critical to take taxpayer dollars very seriously, to live up to the promises of the Medicare Trust Fund that seniors will have health services from the time they turn 65 on for the rest of their lives, and that we have a duty and a responsibility to protect those money. So he asked 2 of his cabinet officers, the Attorney General and me, to actually mobilize an even higher level, cabinet level operation. We've expanded the footprint of the strike forces. We've asked for resources from this year's budget to further expand them and really, created a new office, really kind of ramped up our activity, knowing that even if you steal just a tiny fraction of Medicare dollars, it's a huge amount of money in a $430 billion program.
Well, that's actually, you guys both anticipated a question. Tom from California wanted to know, will there be more HEAT offices established? I think you both said that they will be now that health reform is here.
That's the plan. Right now there are 7 cities, and the plan, assuming the budget is passed, will expand to 13 more cities. But even beyond that, we're involved going into other United States attorneys' offices that may not be the task force cities, the strike force cities, and helping to train assistant U.S. attorneys on how to go after healthcare fraud, to use the data that's being collected to identify the most serious fraud in every location. So it's not just going to be strike force cities. It's really going to be every United States attorney's office in the country will have responsibility to look at healthcare fraud. Well,
it's actually interesting. Dennis just sent in this. I think this could be a tweet question. To both of you, when will HHS and DOJ start teaming up with private insurers to launch a coordinated full frontal assault on fraud rings? So it's not just Medicare fraud, right? It's the gamut.
Well, we had the first ever fraud summit a couple of months ago, and not only had various governmental agencies, but did just what Dennis has suggested, invited in the private companies who often have very sophisticated tools that they've been using to share strategies, to talk about collaborative efforts, to talk about ways that we can learn from one another. And that dialogue is very much underway in the joint HHS-DOJ task force operation. We definitely want not only involvement but expertise from the private sector. We're trying, and Peter might want to talk about this a little bit, the kind of data that Gary is talking about really would be Medicare billing data put in one place, which we've never had before. It's usually been split up in 4 or 5 or 6 sites, but then being able to share it real time so you can see dramatic differences in activity and allow people, the same way that credit card companies can figure out suddenly you are on your bill is showing up purchases from Portugal, and yet usually you purchase things in Virginia. And they'll call you and stop those purchases. We want to be able to do very much the same thing in Medicare, so we're not always after the fact, but we're actually able to stop those billings, stop those payments if something seems to be really awry.
We're going to take 5 more minutes and answer a couple more of these questions, and then we're going to wrap up. But Peter, actually, that'd be great to respond to the Secretary's question. I have one more question for you after that, too.
Sure. The private sector, the private insurance companies face exactly the same kind of fraud scams that we face in Medicare and Medicaid. same fraudsters even perpetrating the same frauds against both the private sector and against the public programs. So we are definitely coming out of the Fraud Summit. We've begun a series of meetings with the private sector on identifying best practices, identifying ways that we can share information, and identifying ways that we can use some of the more modern analytic techniques to look at what's happening and to try to predict where the problems are going to be ahead of time.
Connie wanted to know how the new law will help CMS, which I think you talked about earlier. Kathy from Florida wants to know, how about this newly established South Florida Fraud Hotline? That's one of the programs that CMS has been running for a while,
That's right. We've invested millions of dollars, and it's been paying off in terms of the South Florida Hotline. We've gotten thousands of calls, many of which have led to a variety of follow-up investigations and actions. And that's one example of how we are expanding, and we're doing this in collaboration with the Administration on Aging, of how we're expanding our outreach to Medicare beneficiaries to get them more involved in helping us both fight and prevent fraud. But the South Florida Hotline is designed to be very responsive. It's designed to take calls and get feedback right away to the Medicare beneficiaries when they call in, and then to provide the information when appropriate to our law enforcement partners.
And 1-800-Medicare is still a good resource for people,
1-800-Medicare
right?
is where every Medicare beneficiary should call for information about their Medicare coverage and about the benefits, and if they think there's any problem, they should call 1-800-Medicare and talk to one of the people who answers the phone, who are very knowledgeable about this. And then also 10 million Medicare beneficiaries are using mymedicare.gov online, and that's a terrific source of information as well.
All right. This one more question about rebate checks, and I have a closing question for all of you. Rona wants to know, who will the $250 rebate checks be sent by, and what will the return address on the checks be? That is a question we might have to get back to Rona on, but maybe Peter knows.
The checks will be coming directly from Medicare, but I don't know what the return address is going to look like.
My sense is it will definitely make it clear that it's a government mailing, that it will come from the Office of Centers for Medicare and Medicaid Services, but from the U.S. government. This won't be a company check. It won't be a personal check. It will be a government check. So whether it's the central office address or the Baltimore address, it will definitely relate to, an official government mailing and come directly to the beneficiary.
And in fact, we can actually probably post it when we get closer, at least the address online.
And what the envelope is going to look like.
Right.
Because that's actually a terrific question, because that's the kind of thing that we want people to do, is to pay attention to what they're getting in the mail and separate the real things from the fraudulent ones.
Great. All right, well, let's close with this, I think, excellent question from Melissa from Utah. I'm going to ask each of you. You can repeat what the other person says, but it's not a hard question. And Peter, we'll start with you and work back to the Secretary. What advice would you give to seniors or their families about healthcare fraud? Are there things that they can do every day to prevent them from being a victim?
There are lots of things they can do. I think the first piece of advice is just to be aware that there are people out there who are trying to commit fraud against Medicare. They're trying to steal the identification of Medicare beneficiaries so that they can bill in their names. They're trying to steal the identification of Medicare doctors and other providers and suppliers so that they can submit claims on their behalf. But of course, the money never gets to those doctors or suppliers. And so the first thing is to be aware that this is happening, that it's going on, and that they have to be vigilant about it. And the second thing is to guard their identity closely, and when they think that there's a problem of any kind, they should report that as quickly as possible. 1-800-Medicare, as we said, is one great place to check out what your Medicare history looks like and whether there's any funny business going on with your Medicare claims.
Kathy, what would you say to seniors?
Well, that if it sounds too good to be true, it probably is. And that advice holds true almost in any situation where consumers are being pressured to make a decision and it doesn't feel quite right. We have many resources that can help individuals who, if they have questions, they can call 1-800-Medicare, they can contact their local S&P program, they can call law enforcement, either the federal law enforcement agencies, the state attorney generals, the state insurance department. The secretary sent a letter to insurance departments and attorney generals to warn them that there are scams going on. So there is help available, and just to stop and take time to make a decision, get more information so that they're not victims. It's the best thing they can do.
Gary?
Really just amplifying what's already been said, but my recommendation would be don't give personal information out over the phone. Don't give personal information out over the internet if you don't know who you're talking to. And there's no situation that's going to require you to rush to make a decision. So if you're not sure of who's talking to you or why, then get the person's name and phone number, and you can call them back if you wish, and then go talk to people that know and can give you the advice as to whether or not there is something that appears to be fraudulent or wrong about that type of contact.
Well, and I think all this advice is great. The Affordable Care Act absolutely did not change people's guaranteed Medicare benefits, whether they're in the traditional Medicare or in Medicare Advantage. Their guaranteed benefits are the same, don't have to do anything to do that. And Medicare is typically not sold door to door. So if somebody knocks on your door or comes by your house or apartment or the residence where you live and suggests that sign your name here, give a little information, and he or she will help you, it's not coming from the government. So checking it out, following up, calling 1-800-MEDICARE, going to stopmedicare.gov, stopmedicarefraud.gov, all is great advice because something is wrong with this operation.
Well, I just want to thank all of you. This is such an important topic, and I want to thank you all for watching, too, and sending in really good questions. We're going to follow up on those questions. We also really encourage you. This webcast is available on demand, and you can also watch it anytime you want on our healthreform.gov website. We'll also cross-post it on our stopmedicarefraud.gov site, which we share with the Department of Justice and the people here. Please take a minute, talk to your family, talk to your neighbors. You are an important weapon in the fight against fraud, especially if you spread accurate information, and that's what we're here to hopefully provide you with. Thanks a lot, and we'll see you next week for our next web chat. Thanks for joining us.